In today's Community Focus, Governor Dan McKee joins me now live in studio. Governor, thanks for being here.
Kim, happy to be here.
So there's always a lot to cover, but I want to start with the primary care doctor shortage, especially in light of Anchor Medical Associates closing. 25,000 people in Rhode Island now scrambling to find a new doctor. And Anchor Medical said in their message to patients that reimbursement rates are the reason that they can't attract new doctors to the state. Governor, is it time to stop studying the issue of reimbursement rates and just raise them so we can be more competitive with Massachusetts and Connecticut?
Well, on the Anchor thing, we want to make sure that patients and the doctors get attached to other providers, and we're in the process of doing that right now. So I think that news will come out that it'll provide paths for for the patients to go to and places where the doctors can go. So that's in the works.
So retaining those doctors,
retaining the doctors and making sure that the patients have a direct access to the care. I've had our Department of Health, they actually posted a place where people can go to on a website to see who's taking on new patients, to be helpful there. And the areas in terms of reimbursements, we for the second year we have put in our budget. Hopefully the General Assembly does pass it, which was is a review of the rates. That's the first step to doing something. So you have to get the information before you can actually determine what the remedy is. But I think raising the rates makes sense. It's just a matter of how you do it and where making sure you got the monies that are available. And then we just mentioned about the Medicaid issues in Washington. We really need to see where that settles too, quite frankly, because that's going to have a huge impact, a negative impact potentially, not only Medicaid providers, but the nursing homes. And so it's a complicated issue, but we have done many things already. We put some funding in for docs that want to stay here, making sure that they help them with some of the cost of their education. Yep. And we have other things that we're doing right now to understanding that primary doctor issues are not just Rhode Island centered, they're nationally centered. So we got to find the answers, but we certainly are going to continue to work with the health industry to address it.
The Superman building, as we've heard from Providence Mayor Brett Smiley, the project to turn it into housing has stalled because the developer doesn't have the funding right now. What are you planning to do to try and get that project over the finish line?
Well, I think it's the responsibility of the developer to get the capital stack in place. And we have had conversations with the developer. If you show you got the capital stack in place, if you put some skin in the game that is at risk, then we'd open up a conversation potentially to do more. But really, the ball's in the developer's court right now. They've got to show that the capital stack is there and that they are showing actions actually to get the work done. That's certainly a priority of ours to not only about the housing issue, but we know it's so important to downtown Providence, just like moving the bus hub is. And we're in really good conversation on how we can make that happen in a healthy way.
You've requested raises for 11 directors in your cabinet, including Rhode Island DOT Director Peter Alviti. Some state workers have expressed frustration with that because they haven't gotten their merit raises because of some software issues. Even House Speaker Joe Shekarchi said it's not a good look. Are you rethinking the request? No,
we got to be competitive in that space. When I showed up, we weren't. We had department heads that hadn't got a raise in 5-6 years or more. We have department heads that are earning less money than some of the second and third in charge in their departments. So we have to be competitive. This is it's about an $80,000 ask right now of the General Assembly. I've signed paperwork that eventually, very quickly, the request will be handed to the General Assembly. They'll have 30 days to determine whether they, want to act on it or want to let it go through. My sense is that it's appropriate, and we need to be competitive in, fill-in places. We had places that we had acting people for a decade or more in DCYF, for instance. We had to make sure that we were bringing in good, capable people. We have them. We want to keep them. And this is one way to do it.
The latest Morning Consult poll is out, and you're tied for 4th place when it comes to governors with the highest disapproval rating in the country. Does something like that make you rethink your re-election bid?
No, that's normal for a governor in Rhode Island. Polls come and go, unfortunately. But we're still above water and on these polls, which is good. You got more people believing you're doing a good job than thinking that you're not doing a good job. We got to just keep on doing the work, Kim. And our Rhode Island 2030 plan, raising academic outcomes in every household, raising incomes, making sure we're healthy, and continue with our infrastructure improvements, which we have in the CNBC report in the last report. We moved up 12 spots. So progress is being made. It's our job to continue to let people know what's happening and how we got billions of dollars in the pipeline of work in both the public and private sector. So things are moving in a good direction. We got to keep on communicating with people, and polls do come and go, but we're positioned fairly well.
And we're pretty much out of time, probably just 10 seconds left. But any update on Hasbro? Do you have a meeting set up with the CEO anytime soon?
No, we've had reach out. We've been communicating what's been reported that they've